Hello and welcome back to this 36th video in the series of staying healthy and preventing COVID-19 infection during the current pandemic. So in this short video, I'm going to discuss about what we have learned on a weekly basis over the last couple of weeks. So let's take a step back and go to the goal of interventions. The goal of social distancing is to flatten the peak of infection so that the healthcare facilities and the staff are not overburdened with the caseload. So they'll have the breaks and the facilities can be used efficiently and without harming patient and the staff members. This principle and the fundamental path of action needed to achieve this goal remains the same. The testing, contact tracing, and humane observation, in some places called quarantining. But quarantining need to be done on an individual basis to prevent infection at the centers. Nevertheless, in the absence of community testing, the above-mentioned actions by themselves are insufficient to prevent the secondary peaks of infection, as we see in many countries. So this is simply because in the absence of wider community testing data, no realistic prediction can be made to predict where such peaks is going to occur, and indeed no clue of their severity. So the administration cannot prepare properly to handle these new outbreaks coming unpredictably. Virtually every country grossly underestimate the number of people infected with the COVID-19. Perhaps there's no exception. Therefore, overestimation the death rates. I'll address that and explain it a little bit more detail later. Especially these countries that are carrying out less testing and thereby overestimating the deaths. And especially when there's in the absence of conducting widespread community testing program to understand the realistic figures of the people who are affected. Indeed, I'll discuss a little bit later, the number of affected people reported versus actual people affected could be anything from 20 to 50-fold difference. In other words, grossly underestimating the people affected in the community, because majority do not have signs and symptoms. So let's look at the people who are most affected with COVID-19. Indeed, the old age are affected with COVID-19 mostly, and they also have the highest mortality rate. Indeed, the males are more affected than females, and the studies reported that the patient age over 80 years have the highest in-hospital mortality rates, even when compared to the patients between the age 65 and 79 years of age. So this confirms in a secondary way that the age is an independent risk factor for mortality. However, you have to realize that older people have a poor immune system. Older you get, your immune system is not that strong. Therefore, at a higher risk of contracting infections, specifically viral infection, and having poor responses to treatment, and thereby the higher mortality in the elderly. So in addition to vitamin D, having adequate sleep, getting proper food and exercise, physical activity are also likely to help to maintaining immune system, especially in the age, because they do not have the muscles to generate adequate muscle mass to generate these immune stimulating hormones, for example. Reports from most countries confirm that the elderly patients with comorbidities such as chronic obstructive airways disease or any chronic lung disease, diabetes, hypertension, chronic cardiovascular or renal diseases, kidney diseases, and patients presenting to hospital with the dyspnea are the most vulnerable to develop further complications like acute respiratory distress syndrome and the needing intensive care unit facilities. to save their lives. So this dyspnea symptom is really a dangerous sign of this disease, suggesting that the lungs capacity is getting compromised. So if anyone in the community having a breathing difficulty that they did not have before, you must call the health authorities and seek immediate attention, because this can get worsened within 24 hours. Almost all those presented with a dyspnea or markedly deteriorated exercise tolerance. For example, walking 20 meters make you to pant, the breathlessness. So that's really a dangerous sign. So this is called hypoxia, or low oxygenation in blood. Indeed, this is a poor prognostic sign indicating that the person could rapidly get worse and very likely to require intensive care unit or even assisted ventilation to save their lives. High rate of deaths is also associated with the high prevalence of comorbidities I have discussed, and indeed directly related to lower immunity or immune responses from the body, and indeed for lower serum concentration, especially in senior citizens. All these three conditions are inversely related to the outcomes, negative outcomes. So let's look at another aspect, because we see every day, every hourly, the prediction using various models they have developed in many countries. So let's see how reliable these currently used models are, because virtually every model reported so far failed. So why? So currently there are various models to assess the outcome from the COVID-19. These include the risk assessment models, diagnostic and prognostic models. The ability to predict accurately the outcome of any of these models depending on the precision and the assumptions that included in the model and the quality of data like RO used in these models. In most published models, one or both of these parameters were flawed. Therefore, you cannot expect the models to generate accurate predictions. The occurrences and the failures of flattening the peak of infection and the curves of infection is one good example of failure of virtually every model. Because of the data are unreliable to date, virtually all reported models and predictions are flawed, and in fact they are not only insensitive but markedly under or overestimate the clinical outcomes. In both capacities, this generated conclusion are misleading for the administration and indeed misleading for the public. In addition, faulty assumptions made in this model used also have what you call the high risk of bias, individual bias injected into this model when you are making assumptions. So making this analytical interpretation are no better than the valueless political polls people conducted every day during the election time. So don't pay too much attention to this model and the reports, but concentrate on the local statistics, which is the infection rates and the mortality and the instruction given by the local government, the health departments, and follow those procedures. So in the next video, I'm going to discuss about how vitamin D attenuating the COVID disease, how important having the normal vitamin D level to prevent the disease, prevent complications, as well as the death. Till then, thank you for participating in this important series of videos. Bye for now.